Hi, my name is Justine, and this is my presentation on week 4 and implementing psychedelic assisted therapy. So, I know there were two questions in our assignment, so I'm going to go over them. The first one being, what are the pitfalls of integrating psychedelic therapy into our medical system or family therapy institution? And then the second one being the ethical and safety considerations. So, the hard part about understanding the potential pitfalls of implementing psychedelic assisted therapy within our medical system is that you can attack this from many angles. Therefore, I picked topics that more had to do with research, as I know the clinical trials that are being done haven't been translated into application in terms of our ethical system or our therapeutic system. So one of the first things I wanted to talk about was blinding. So this refers to the keeping information private to both population and stakeholders to reduce bias and expectation. So what can sometimes happen, or in randomized clinical trials, a golden standard would be a double blinding, where basically the person who is giving the clinical trial and the participant does not know what is being given. And this is especially helpful because then certain processes of expectancy don't necessarily happen, and that refers to the expectation of what is going to happen, especially with all the information out there on psychedelics. So a proposed recommendation to help is research design, patient recruitment, incomplete disclosure of information to participants, and active placebo. So there are many levels to where this can be addressed. However, there have been studies that have shown the difficulty with research designs and psychedelics is because that there's so much information out there. A lot of the times the participants have already internalized a narrative or expectation about what is going to happen, and therefore that can skew the results of that specific study. And so that leads to expectancy, which I had kind of discussed before. So expectancy refers to the premature promotion and hype that may influence the. Hi, so I got cut off from my last slide, but I just wanted to finish my thoughts on expectancy and how that relates to blinding. So if participants in clinical trials have been exposed to a lot of information about psychedelics and they have an expectation of how the experience is going to be, that can have an effect on the way their experience is and can therefore also affect the study that is happening, because then there is a lack of objectivity when it comes to that experience. So other pitfalls of implementing psychedelic assisted therapy within our medical system include ethical and therapeutic issues. This includes self-of-therapist views around psychedelics, practitioners who are willing to accept professional ramifications versus those who are driven by a monetary incentive. So because psychedelic assisted treatment is also being very hyped right now, there are those researchers who have been doing this for a long time and have accepted professional ramifications because of the disparities on what is considered legal or what isn't, or even there not being any boundaries toward what is ethically correct within the therapeutic community. But there are also those researchers who understand that this is a fad and want to invest in the time because of the monetary incentive that could take place. Another pitfall is psychedelic exceptionism, which refers to solely relying on the reputation of psychedelics and not considering ethical standards that apply to other therapeutic practices. So because there have been no boundaries set in a therapeutic sense, and this idea of psychedelics being very hyped as a treatment, sometimes what can occur is, due to there not being legal standards yet, therapists may not adhere to the same ethical standards that they have in other therapeutic practices. Other pitfalls are also disparities between psychotherapeutic and pharmacological incentives. So parallel processes to other processes of medicalization. So when we look at that, there is a very different incentive from a therapeutic lens and from a pharmacological lens. And I think the danger we see with psychedelics is, unlike other pharmaceuticals, for example, antidepressants, where the medication is trying to suppress a certain process that's happening in the brain. Psychedelics is disrupting that. And so there is the danger of ingesting a medication that has the opposite effects to accepted psychiatric medication. So that poses an extra risk to psychedelic treatment than other forms of medications that have been accepted within psychiatry. And lastly, we have accessibility, which include labor costs, disparities between for-profit business models, and public health concerns. So again, I've kind of discussed it a little bit before, but because it is very resource intensive and very costly to do psychedelic assisted therapy, when we think of the labor costs and who has access to these treatments, who will benefit from this, and what happens to those who can't afford it. And then there's also, when you look at research, the disparities between for-profit business models and public health concerns. So if these for-profit businesses are trying to also advance psychedelic assisted therapy, why is that? And are they really taking into consideration what the ethical concerns are when it comes to psychedelic assisted treatment? Now we have the safety and ethical considerations. So the first would be set and setting, which is the set and setting has a strong influence on the subjective effects of psychedelics and should be taken as a confounding factor. So like I said in the previous slide, because ingesting psychedelics really has an effect on one's cognition or even consciousness, unlike other medications where the set and setting don't matter because it does its job without, I guess, having a mind-altering state. The set and setting of how a drug is ingested plays a big role, so that is something to consider when looking at psychedelic-assisted treatment. Another one is integration. Unlike taking antidepressants or something else, a very important step of psychedelic-assisted therapy is being able to integrate the experience of being on psychedelics into one's therapeutic goals and one's everyday life to create meaning within it. So bridging and integrating the psychedelic experience with therapeutic goals and insights. And last, dynamics between providers. What does informed consent look like? How does one navigate conflict of interest? Navigating one's scope of practice would look like what? So I think this comes with the fact that when we look at our code of ethics, this is not being addressed yet. So when we look at the dynamics of what it looks like between either therapist and provider or provider and clients, there is still not a, I guess, step-by-step or boundaries as to what we can do or what we can't do, or who is considered, who can have the scope of practice to do this. So I think those are many issues that have yet to be discussed and will have to be discussed, especially if it is integrated into our medical system. So thank you for watching my presentation, and here are my references.